Hi, Miriam. I'm Sarah. I'm a student nurse. I was wondering if I could have SBAR on the patient.
Sure. Let's see. This is Miss Shanana O'Connor, 34-year-old female. She came in with a fever of unknown origin at 5:30 in the morning via the ER. Also, she's got renal failure end stage. She reports high glucose readings for the past few days and minimum urine output for the past month. She's been on dialysis for the last year. Aside from her renal failure, she's a type 1 diabetic. She's got hypertension, peripheral neuropathy, and proliferative retinopathy. She had a graft infection 3 months ago. It was easily treated with some IV antibiotics and it resolved. The graft was initially placed 11 months ago. Other surgical procedures were a tonsillectomy at age 10. Both parents are alive and in good health. She is ANO times 4. Reports some numbness and tingling to the lower extremities due to the neuropathy.
Okay.
No respiratory complaints, no cardiac complaints. She's had a recent weight gain of about 10 pounds in the past few weeks with decreased appetite and decreased intake.
Interesting.
She denies any abdominal pain and changes in bowel habits. She's on a fluid restriction of 1,500 mLs per day and a renal diet with a multivitamin and calcium supplement. She reports a decrease in urination with concentrated dark urines and denies any difficulty urinating or any burning or any discomfort. Skin is all intact. Her glucose have been pretty high, 200 when she first came in, but they're down to 155 today. She had white blood cells in her urine, so the doctor's prescribing some antibiotics. Aside from the clotidine, she'll be receiving some imipenem mixed with some salistatin.
Okay.
For the infection. She's appropriate. She's communicates verbally. Appropriate emotional status. She does not smoke. Does not do any drugs. She quit smoking about 2 months ago. So basically, she needs dialysis today and to get her antibiotics.
Okay. Why specifically is this client receiving this medication?
The medication is an antibiotic. It's a broad spectrum antibiotic. So the doctor's suspecting infection, but the cultures are not back yet. So he's going to put her on this first and until the cultures come back.
Okay. What action does this medication have on the body?
Well, it destroys the cell wall of bacteria.
Okay.
But it also has effects on the liver and kidneys. So those levels need to be monitored.
Okay. When should you question administering this medication?
If you should question administering this medication if the patient does not have any signs of infection or if she has an allergy to carbapenems.
Okay. Does the medication have a therapeutic serum level?
It does not.
Okay. Which vital signs need to be monitored?
All the vital signs need to be monitored. Pulse and temperature would be the top 2.
Okay. Which physiological parameters should be monitored when the medication is being administered?
Watch for signs of anaphylaxis, any rashes or hives or anything like that, or difficulty breathing. Also, we would like to check the IV site, make sure there's no redness or edema, infiltration of any kind at the site.
Okay. What interventions must be taught for the client to ensure the medication is administered safely in the hospital setting?
She needs to be taught what medication she's being given, so she knows what to expect when someone shows up at her bedside with medications. And also what to look for as adverse effects and what to report to the nurse.
Okay. What interventions must be taught for taking the medication safely at home?
This medication is an IV medication. It would not be given at home.
Okay. What are the side effects and potential adverse reactions of this medication?
It sometimes, a very low percentage of people, causes some kidney destruction or failure, or liver failure. Other than that, watch for anaphylaxis.
Okay. How will you know the medication's effective?
The white blood cell count should normalize, and the infection, so the infection should be showing signs of going away.
Okay, that makes sense. Those are all the questions I have right now.
All right, let's go give this medication. Before we go in, though, I'd like to check the order.
Okay.
So I'm pulling up Shanana O'Connor's chart, and I'm checking that the imipenem is ordered today at this time. IV piggyback.
Okay.
500 milligrams.
Okay.
All right. Uh-oh, what did I do? Okay, so again, I'm going to check this to the MAR and make sure that I have the normal saline that we give with the imipenem, and then the imipenem 500 milligrams, and all my tubing and all the equipment that I need. So we're going to do hand hygiene.
Okay.
Knock, knock, knock. Shanana, can we come in?
Sure, come on in.
All right, so. Hello. How are you today, Miss O'Connor?
I'm okay.
It's time for your antibiotic therapy.
Oh, okay.
Can I have you verify your name and birth date for me, please?
I'm Shanana O'Connor, and I'm 34 years old.
All right, yes, that's what the bracelet says. And do you have any allergies to any medications?
Yeah, I can't pronounce it. Try something.
Oh, yes, here it is. We'll call it TS. So now I'll check the MAR again. Shanana O'Connor with the imipenem. Let's scan her bracelets. I'm just going to scan your bracelet.
Okay.
No, that didn't work. Let's try that again. And stand by. I'm gonna have to scan your bracelet one more time.
Okay.
There we go. Okay, so we're scanning the patient in to receive the sodium chloride, normal saline, first,
Okay.
because that's what we're gonna administer first. And it turned green.
Okay.
So it is 0800 hours right now.
Yep.
Okay. So let's prepare the normal saline. So we're going to take the cap off this part and make sure that it stays sterile.
Okay.
And then also take the cap off the spike and make sure that stays sterile. We want to make sure the tubing is closed.
Okay.
And fill up the tube about halfway. And, oh, where's my little thing? You had to record that.
We can't stop it.
Oh, that's true. Okay, so we're gonna hang that up lower because we're gonna hang a piggyback. And then now we're gonna let the solution kind of get all the bubbles out.
Okay.
Yep. All right, we're gonna keep the cap on the end on.
Okay.
Or actually, we're just gonna connect it to the patient since it's clean right now.
Okay.
And I'm going to clean the hub on the patient. Actually, first of all, we're gonna flush. Let's make sure the site is patent and there's no edema, redness, or pain or discomfort.
Okay.
Shanana, let me know if you feel any pain. All right, let's unclamp because that'll help.
I've done that before.
Okay, did you feel any pain?
Nah, it feels fine.
All right, very good. Now let's connect it to, so we'll clean this part. We'll clean her hub again and connect it.
Okay.
And it is clamped at this time until we set up the pump, which we can set up now. So again, we're gonna check the order in the MAR. It says 30 mLs per hour.
Okay.
For Shanana O'Connor. So we'll go 30 mLs per hour, and it's 500 mLs. Yep. Okay, so then we'll do 950, so that it does not become completely empty.
Okay.
And we'll push start, and it should start going. And we'll make sure that it's going in fine. Watch the drip chamber.
Okay.
It's going to check the line. And of course it says it's occluded, even though it's not.
Yeah, they were having problems with this pump earlier. Making all those beeping noises.
All right, well, there it goes. It's making a funny noise, but hey. So we will annotate here that we Okay, so now that we did that, we will administer the antibiotics. Oh, for the love of God.
Because you hang that piggyback, right?
Right.
Okay, yeah, that makes sense.
So now, Miss O'Connor, let me scan your bracelet again.
Okay.
Now we'll scan the medication, the imipenem.
And it turned green.
All right. All right, so now let's spike the piggyback.
So same thing, you want to make sure you don't contaminate either part, right?
Mm-hmm, yes. That is correct. All right, and we want to prime the tubing.
Okay.
And we will use a alcohol prep to scrub the hub over here above the pump.
Okay.
Let's take the cap off that. And we can undo this part. Now we will secondary infusion. We'll select imipenem.
Okay.
And it is going in. Oh, sorry. Didn't mean to step on your toes there. We'll just double and triple check the dose. Okay, so 500 milligrams in 100 mLs. There we go. And then when the piggyback is done going, then it will revert back to the flow rate of the normal saline. All right, back over here.
That was really interesting.
I'm just documenting that I administered the medication and which site I documented in and my initials. And now, all right, Miss O'Connor, is there anything else you need today?
No, I'm doing just fine.
Okay, well, I printed up some information about the imipenem.
Oh, thanks, sweetie.
And so let me know if you have any loose stools or excessive diarrhea, and make sure don't
Ew.
take any medications such as anti-diarrhea medications while you're here at the hospital without consulting a nurse or a doctor, okay?
Okay,
Here you go, ma'am.
thanks.
Well then. We'll just leave it like that. Okay. So do you have any more questions for me?
Yeah, I have a few. Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes. Her AST and ALT,
Why were those important?
because it checks for liver functions, and this particular drug is metabolized by the liver.
Oh, that makes sense. Did this information affect your decision to administer the medication?
If they were elevated, I would have consulted the physician.
Okay. Did this information affect how you administered the medication?
No, this is an IV medication. The route is pretty much determined by the pharmacy and the doctor.
That makes sense. Okay, thanks for showing me around today, Mariam.
No problem. Have a good day.